Well, good afternoon, and thank you all for joining us over your lunch hour. I hope the information is helpful to you. I have a lot of great videos that are included in our discussion today, and since we're a smaller group, I hope that we'll be able to have more of a dialogue. So as Kevin said, my name is Maris Williams. I'm a pediatrician here at UNM at the Center for Development and Disability. I work with a program called the ESEP program, which stands for the Early Childhood Evaluation Program. And I have a contact slide a couple ahead through this PowerPoint. We see children ages 0 to 3 where concerns about development or medical impact on development are part of the question. And we have a team that's a speech therapist, a child psychologist, a motor therapist, and a pediatrician. And so we do a very comprehensive evaluation. It takes about half a day. And we travel all around the state, so I'm not sure I've been to Portales, but I've been near, and we think it's really important to see children in their home community so that the early intervention providers and teams that work with kids are part of our assessment and discussion at the end. So we frequently do see very young children where there's a question of autism spectrum diagnosis, and I'm really impressed with this learning program and the videos that accompany it as far as helping us pick up some of these very, very young kids. None of the material is copyrighted, so you may freely copy the handouts that are part of the discussion today. The CDC just asks that you give credit to those who developed this early warning signs autism case training, and that's the Center for Disease Control and Prevention, the National Center on Birth Defects and Developmental Disabilities in partnership with Health Resources and Service Administration and the Maternal and Child Health Bureau. So that's kind of a long slide. That's a lot of credits, but again, you're welcome to give these handouts to your colleagues, to your families that you work with, etc. So let's talk just for a minute about why the case that I'm going to present you today is important. We know that in the United States, most autism spectrum disorders are picked up or diagnosed in children between the ages of 3 and 7. And yet these parents have often had concerns about social engagement or communication on or before 18-month well child check. So if we can start recognizing some of these very young children, we can get them into educational and intervention programs really early. These EI programs will really help children gain competency in the areas of need for them, such as social engagement, social interaction, communication, and they have a better chance of being able to be mainstreamed in schools as they grow. So we're really trying to put the word out to refer these kids early. I'm sure you have heard some of the numbers for autism incidence. The CDC numbers right now are 1 in 88 children, which translates to about 1 in 54 boys, 1 in 252 girls, and across different cultures, it's about 1% incidence. So this is a lot of kids that are being impacted. The kids that frequently get picked up early are those that have more classic signs like hand flapping or toe walking, but children who are often diagnosed later are those that have seen a lot of different care providers or live in rural communities. This again is my contact information, and that's my direct office line. You're welcome to email me if you have questions or comments. Kevin is telling me to plug my computer in. Okay, thanks. So let's move on to our learning objectives, which I think were published with the schedule for the talk. So really just two main goals today. First of all, we're going to look at a case of a 24-month-old little boy. And so I'm hopeful at the end of this hour that you'll be comfortable describing typical social skills present in children up to that age, language milestones in that age range, and play skills also. And then also that you'll have more information about recognizing the major early warning signs of autism spectrum disorders, including the key red flags, and some more information about trying to differentiate typical temper tantrums from those of a child with an autism spectrum disorder. I hope that you have in your arsenal for lunch today a bunch of handouts. I think they were emailed to you separately, and I'll be referring to those throughout the course of the case. So I know you have this case in front of you. I'm going to go ahead and read through it, and I hope you'll take some notes and have comments for me at the end of the case. I like this case because this is a family member, and you're at a family reunion. And I think as healthcare providers and people who work with children, we're often approached by family members and asked questions about medical things or developmental questions, and we just really always want to have the best information for our family members. And this is a little bit of a sticky situation, as you'll see as the hour progresses. So I hope you don't mind, but I'm just going to read this case to you, and then I'll ask for your comments at the end of it. So you are attending a family reunion, and during a quiet moment, your cousin Elizabeth takes you aside and asks what you think about the development of her son, Mark. She tears up as she tells you how worried she is about him. He will be 2 years old next month, and he seems so different from the other children on the playground. Although he is an affectionate and happy little boy, his behaviors can be so unpredictable. He's very shy and has terrible temper tantrums. It is usually impossible to reason with him. Small changes in his routine throw Mark off, and Elizabeth is worried that he won't be able to handle the crowd at this family gathering without causing a scene. You ask her what her pediatrician thinks. She tells you that Mark has been seen by his pediatrician. She has expressed her concerns about his temper tantrums on a few visits. The doctor has told her to give him some time. He is still young and will likely grow out of this phase. Mark enjoys going to the doctor's office because they have a large tropical fish tank, and he has generally been calm in that setting. Mark's doctors have all been very reassuring and think he has a bad case of the terrible twos. You have been preoccupied by your relatives, and you honestly haven't been paying too much attention to Mark. You know that your cousin is a doting and caring mother. She and her husband Sam had fertility struggles, and she was thrilled to give birth to Mark after a grueling course of in vitro fertilization treatments. You know that Mark was born full-term without any complications. You heard he was a fussy baby, but he was otherwise healthy. So I know there's some delay on the microphones and computers, so I'm just going to pause for a moment and ask you what stands out to you about your cousin Elizabeth's concerns. Quiet bunch at lunch today. Should I forge ahead? Any thoughts about Mark? Well, let's go back to the case for a second and see what we think about Mark. It sounds like overall he has some trouble communicating, and it's hard for Elizabeth to work with him about behavior. For example, it's impossible to reason with him. So this might be a little boy where he's not really understanding contingencies, like, first we do this and then we do that, or it's hard for him to use his language to help with behavior. Sounds like he's a little bit rigid. He loves the fish tank, and it sounds like temper tantrums are an issue for Mark. Any other thoughts before I move on with some of the developmental milestone objectives? Well, let's start with the fact that what are typical social milestones for a 2-year-old? And first, let's think about what's typical for a 12-month-old, an 18-month-old, and a 24-month-old. So already a 1-year-old, and if you have a 1-year-old of your own or work with one or know a baby this age, you know they're very engaged. They have eye contact. They're starting to point at things that they want to request. They respond to their name. By 18 months, there's something called joint attention, and this is a really key phrase that I hope that you'll be familiar with at the end of this hour. Joint attention is where a child expresses enjoyment in sharing an object or event with another person by looking back and forth between the object and the caregiver. So it's that whole circle of I see it, do you see it, are you as excited about it as I am? It's a critical but very subtle aspect of social interaction, and the lack or impairment of this is a core feature of autism. It's not that all kids with autism will lack joint attention, but it will be difficult, weaker, or inconsistent for them. And joint attention is something that's developing in the second half of the first year of life. So you'll see a 7 to 12-month-old with joint attention, but it's really should be consistent by 14 months of age and certainly by 18 months of age. And then think of a typical 2-year-old imitating, excited, interested in other children, and very desiring of attention. So I have a number of videos to show you next, and I think when we did this case before about a month ago, one of the comments was, at the end of all these videos, the case seems like it was a long time ago. But I do want to sort of show you examples of typical and more unusual development with these videos. Okay. So this first video is a 12-month-old named Kyle, and just watch with me for a minute here. Kyle! Hi! Yeah! Hi! So I'm going to play it one more time and stop it in the middle. But as you can see, he responds immediately to his name. He has lovely eye contact, and he's pointing at the camera or at the person who called him, already showing his shit. Kyle! Hi! Isn't that great? So he's distracted immediately from what he's playing and sharing this engagement with eye contact and vocalization and a point all meshed together to show that he's socially right there with you. Okay, we're going to look now at another little guy named Evan, and hopefully you guys will have some comments about Evan. There's your clue.
You want to try to see if you can get him to respond to that?
No.
Mm-hmm.
Evan. Evan. Evan.
See maybe if you can get him to respond to you now, you can use touch with his name, like give him a little tickle or something.
Evan. Evan. Evan.
He likes the tickles, but he's just not giving you too much eye contact, but he does smile when you tickle him.
Evan. Evan. Evan.
So I'm just going to pause for a minute and just ask for any comments that you might have about Evan.
He sure doesn't seem interested in his name.
Exactly. And that brings up an important point. You know, all of these children where autism is a concern should have a high-quality hearing test, because you might look at a video like that, and one of the questions that we ask on the MChat, or we ask parents, is, have you ever been concerned that your child is hearing impaired or deaf? And you're exactly right, he just doesn't respond at all to his name. So if Evan's 18 months, what do you think about how he's playing, how he's exploring? Sort of turned his back.
You want to try to see if you can get him to respond to it?
No. Evan. Evan. Evan.
See maybe if you can get him to respond to now, you can use touch with his name, like give him a little tickle or something.
Evan. Evan.
So here's an 18-month-old who's really at a much more immature stage of exploration of toys. He's mouthing the toys. He's not really using them to build or exploring them in a more sophisticated way. I really like it that the therapist working with this mom helps mom end that engagement on a more positive note and says at the end he really responds to the tickles, and you can see that mom is smiling right here, but there's this underlying tension when children don't respond to their name, and parents are very aware that that's unusual. So he really only smiled with the physical prompt, and he's completely faced away from these important adults in the room. So obviously this is a worrisome setup. So this is joint attention, and I think it speaks for itself, and they play it again in slow motion, so you'll have a chance to watch her eye gaze as she's playing with her mom and brother.
You see? And the doggy is saying hi to the bear. Okay. That's it? No more? No more? Look it.
See, it's subtle, that down, up to her mom, back down. Do you see my book? Do you see what I'm pointing to? There it is again, that shift in gaze. And that's pretty subtle, but certainly something to watch for.
You see? And the doggy is saying hi to the bear. Okay. That's it? No more? No more? Look it.
So I have quite a few videos for you guys. What are you thinking of these videos? Are they okay?
Yeah, I like them.
Okay, good. That was one of the criticisms I think last time, was that I had too many videos, but sometimes it feels like they really speak volumes for what we're looking for. So here's Evan again.
That one doesn't have anything that pops.
And I'd like you to watch this during the course of this tape.
It's for you, Evan. It's for you. Look. Hello? Oh, you want to talk to Evan? Here you go.
Some thoughts about Evan again. Well, he really, he just doesn't have that same joint attention piece that Noeliah, the little 15-month-old who's even younger, showed in the previous slide. He's not really playing with that toy phone in an appropriate way. I know kids don't see phones that look like that anymore, but somehow you seem to know that you should put the handle to your ear and dial the ringer and look at someone and say hello, pretend you're talking to your mom or dad on the phone. He seems more preoccupied with parts of toys than with how the toy might be used to engage socially. So he really is lacking that pretend play piece. Next slide is another example of just really unusual eye contact. And this is a short one.
Lay down, do this. Look at me. Very nice. Lay down, look at me, Shauna, look at me. Look at me.
So what do you guys think about Lee Dion?
She doesn't make eye contact even when she's being touched by her mother.
Observation. In fact, she almost seems to avoid it, doesn't she? Like, let me look anywhere but at you. Yeah, I agree with you. So it really takes a lot of physical input even just to keep her in that space where she could make eye contact with you. And here's another sort of nice example of imitation of speech, joint engagement, interaction with mom. And again, this is a really young little girl. She's only 14 months.
1, 2, 3, 5. 5. 4 little kittens. 1, 2, 3, 4. Nice little kittens. Amen. Look. Bunnies, 5 cabbages. 1, 2, 3, 4. 5. Cool.
So really quite a difference. If you look at how this little girl, Caitlin, uses her eyes to make sure everyone in the room is part of what she's doing, to share her enjoyment and her engagement. And, just another point about that, when we see children who are visually impaired, and often the vision therapist from NMSBVI will accompany these kids, we need to be really mindful of how that impacts their eye contact and their ability to use their eyes in social engagement. So that's the end of my little stretch of videos for now. I know it's been a little while, but let's go back to Mark and the mom's comment about, well, people say he's just shy. And what are some of the important differences between a child who's shy and a child with an autism spectrum disorder? So shy children tend to be very hypervigilant. They scan the environment. They often will maybe avoid contact with the stranger, but they may have increased eye contact with their parents or the people they trust because those are the people that they're frequently checking in with. Whereas children with autism are not so vigilant, they don't necessarily reference their caregivers socially. They might cling to a caregiver, they might be very anxious, but that the eye contact is different. And if you look along this list, it's also handout 2 among the handouts that you have at the end of your packet. You can see that these qualities listed under autism spectrum disorder actually go back to the Diagnostic and Statistical Manual, 4th edition. These are some of the criteria for a diagnosis of autism spectrum disorder in the DSM manual. So lack of this seeking to share interest, failure to develop peer relationships or a preference to play alone, impairment in eye-to-eye gaze, and really lacking this back and forth play. That's such a huge piece, that wanting to play peekaboo back and forth or roll a ball back and forth or just taking turns in any type of engagement. So kids who are shy will be able to do all these things once they're comfortable. It just takes them some time to warm up. So when you hear a child shy, maybe ask how they do across environments or with people that they're comfortable with. So what might we say to Elizabeth? We might want to ask her about some of his other developmental milestones. We might want to ask her more about the temper tantrums. And I think it's really, really important that we look at families and children in a strengths-based approach. So I'll ask you first what you think are the strengths of this of this child and family. And if you want, I can go back to the slide from the case, or if you remember it well enough. Any comments about the strengths for Elizabeth and her family and Mark?
I think it's great that the mom is still pursuing more information, even though her doctor has said he'll outgrow it.
Exactly. I think parental instincts, we as health providers, we need to so listen to parents when they have concern. And she's seeking more opinions, even though the information that she gets might be really hard for her to hear. But you're right. Well, I know the case was a little while ago, but I think, just the fact that we know that they had fertility struggles, so obviously this is a very desired baby. There's an intact family. And at the very beginning, she describes him as affectionate and happy. And it's so lovely to hear a mother, describe her child in such a positive way. Sometimes kids who have developmental problems also have behavior differences or difficult behaviors, and the parents may perceive that as misbehavior when maybe they have sensory issues. So it's nice that Elizabeth has this positive impression of her son. The next part that we could review with the other developmental milestones is the handout entitled Your Child at 2 Years. And these are some of the other things that if we were talking to Elizabeth, we might ask Elizabeth if Mark is doing. There's a long list here, and they're broken down into social, emotional, language and communication, learning, thinking, and problem solving, and then physical development. A point I'd like to make here is that there's certainly a wide range of normal development for language in toddlers, but a 2-year-old would typically have 50 words in their vocabulary and start putting sort of short telegraphic sentences together that are functional, right? Like, I want more juice, I want to go outside, where's Dad? Saying their pets' names. They should be able to follow simple directions. They should be understandable with their articulation half the time and start to tell you about their body parts and who familiar people in their world are. The social emotional ones we talked about a little bit more. 2-year-olds are becoming independent, but as they're starting to put something into the plug in the wall, they're looking back at you to see what your reaction is. So typically they're wanting a reaction. They're wanting engagement with the people in their world. They should be imitating. We all learn so much by imitating other people and having models. And they should have beginning to get a sense of humor, laugh at silly things, and getting excited when cousins or other children come into their world. There's also a box on this handout, and I hope you all have it, about some of the concerns, and some of these will be covered again on the early warning sign sheet. But a child who isn't using 2-word phrases, doesn't know what to do with common things, like they might collect forks and spoons, but they don't eat with them, or they might carry straws around, but they don't drink with them. We saw one little boy with autism who had little collections of straws all over the house. Doesn't copy things, doesn't point, doesn't follow simple instructions, has difficulty with balance or motor skills. And then this last point is a huge one, loses skills that they once had. And we see language regression and sometimes social regression too in about 20 to 30% of kids who end up with an autism diagnosis. And this is another reason why we screen for it both at the 18-month well-child check and at 24 to 30 months, because it helps capture some of those kids who have lost skills, which is should truly raise your level of concern. I'm going to just stop for a minute before I go to the temper tantrum handout and ask if you guys have any comments or questions so far.
I was going to tell you about my 2-year-old granddaughter who we just figured out can't see. She had a lot of these behaviors. But after we got her glasses, it was amazing. She completely bloomed.
what kinds of things did you see?
Well, she wouldn't interact because she couldn't see. I mean, she's terribly farsighted. She truly was practically blind. So she wouldn't interact. She didn't recognize people. She always wanted to just be in her dad's lap because she knew she was safe there. She stumbled and fell all the time.
All the time.
I don't know why we didn't figure out she couldn't see, but when we finally got it figured out, it was amazing the difference.
Oh, that's great. I'm really glad, too, that she's still so young. And, sometimes we see that kids are so much more comfortable with eye contact across the room as opposed to up close. And so vision, I'm really grateful you brought up that point. Vision is so important.
Well, she wouldn't even watch anything on TV. I mean, it was like TV wasn't even on in the room.
Not even interested.
Right.
And probably not pointing at things because she couldn't see them. And so I think your point is really well taken, that we really have to assure that these children have typical vision and hearing before we start to classify these as red flags for autism.
And it's not easy to do a vision screen on a 2-year-old.
It isn't. I'm fortunate. I have some cards called teller cards, and they are cards with stripes that start out sort of like a black and white mobile might be, with huge contrast, and they go until they're harder and harder to discern. But they don't require, your eye just automatically goes to the side with the pattern on it, and at the point that you stop discerning the pattern from the plain side, I can tell your vision is 2060-ish, 2100, or 201300. But those cards are really expensive, and unfortunately they're not in a lot of general pediatricians' offices. And so I think that would be great if everybody had vision.
Because she had been to all her well baby checks, but never had anybody thought she couldn't see.
Right, and some of the tasks we do require like picking up a raisin and putting it in a bottle or something, and that requires vision. But I think sometimes people don't actually watch how children use their eyes and hands together functionally in a well child check, and it's just a great point. Well, let me just refer you to the handout number 4 on temper tantrums. That's the second bullet here on this slide about when temper tantrums are sort of beyond the pale. And we get a history from some families that they're really walking on eggshells with these kids. So a temper tantrum can be set off by the carrots touching the peas, or the bed isn't made just right, or I had one little guy who, if his parents forgot and they opened the garage door with the garage door opener and didn't let him do it, he had such a terrible temper tantrum that they had to back the car back out, drive all the way around the block, and let him be the one to open the garage door. So this sort of degree of rigidity is unusual. I mean, a lot of kids will have meltdowns in the checkout line when you don't buy them M&Ms, but when you can't get through your day without having 20 or 30 just episodes over things that would seemingly sort of roll off the back of a more typical toddler, that's when it's time to get some input from an early intervention agency or your pediatrician or whatever your resource in the community is. So this is just some general information about temper tantrums. Okay, so let's move on to a little bit more of the case, because I think we're going to go in a different direction here with Mark, and we're all going to be a little bit more worried about him than we were before. So during our conversation, we find out that Mark met his milestones typically, so that's a very positive thing, and that's a good prognostic thing for him that he was on target for that. By a year of age, he was walking. Now he's climbing on everything. Well, sometimes kids climb on everything because they don't have a way to ask you to get things. So keep that in mind. He has started to repeat words, and thanks to a beloved Dora the Explorer DVD, he has learned many of his letters and can count to 10 in Spanish. You ask about how Mark communicates and gets what he wants. Elizabeth says he is very smart and that he usually tries to get things himself. She cannot recall of a time that he pointed or gestured to get his needs met. So here's a 2-year-old who's not pointing, which is a huge red flag. At that moment, Mark wanders into the room. He starts to run back and forth while verbalizing, fast, fast, fast. You call him many times, but he does not seem to hear you. Elizabeth says that he's a very busy, active boy, and he acts this way a lot. He stops his playing and begins to spin the wheels of a toy train. Now you are beginning to get concerned. These are not normal play behaviors. You even think back on your family history and can't recall anyone with autism. So, thoughts about Mark now? What are some of the concerns for you guys in the case now?
Some of that repetitive behavior, both with the spinning of the wheel and the echolalia, the fast, the repetitive.
Exactly.
And he's not engaging. You know, I think his mom called out to him. Is that right? And he's just not engaging.
Right. And you call. I think it says one of you calls. I can't remember. One of you calls out to him, and so he's not responding to his name. You captured pretty much the gist of this perfectly. He's not responding to his name. He's focused on the part of a toy rather than the toy as a whole. So the wheels of a toy train. We have a press in one of the screening tools we use when we're looking at autism, and there's a baby doll in the play scenario, and sometimes kids will get really caught just flicking open and close the eyes on the baby doll.
That's the
so
ADOS.
Just, pardon? Yeah, exactly, the
ADOS.
You're there.
Yeah.
That's in the ADOS where there's a little birthday party for the baby, and sometimes it's a very lonely birthday party.
Yeah.
But they really will enjoy. Some of these kids will have difficulty playing with the baby as an agent, like feeding the baby, having the baby get a drink. They're just focused on a small part of the baby. So, and then I learned the last time, I didn't know this, but fast is sort of a chunk of language from Dora the Explorer. And one of the people online last time said that was from the video. So these are some unusual communication behaviors. He's not socially engaged. He doesn't point. He gets everything for himself. He's very independent. So now our initial reaction is to be more worried. So if we think about, okay, what are appropriate play skills for a child Mark's age, and I think we captured a lot of these, but a 24-month-old should start having symbolic play. They should be able to pretend that a block is a little piece of food and pretend to give it to a baby. They should use objects as complete toys rather than a small part of the toy, and they should be excited about the company of others and imitate the behaviors of others. And then concerning aspects of language development in this case and what you would like to see in a child's language at 24 months. So a 2-year-old, like we said, should have about 50 words and really have what we call functional language to get their needs met. So counting to 10 in Spanish shows nice intellectual capacity, but it doesn't help him get juice or take a bath or go outside. While that speaks to his cognitive ability, it's concerning about his communication ability. Actually, for the crux of this dialogue today is handout 6, which are the red flags of autism spectrum disorders. And I have a really great video of a set of twins, and one has autism spectrum disorder and the other one is typically developing. And so as we look at the video of these twins, let's look at handout 6 in terms of red flags for autism spectrum disorders. And so we'll be looking, I'm just going to take a minute. I think it's important to really drive home these points. Impairment in social interaction, again, I want you to attend to their gaze, to their joyful expression or lack thereof. Is there shared interest? Do they understand contextual cues, like putting a hand out to be handed something? Do they respond to their name? Do they coordinate nonverbal communication? So if we think back to the video where the little boy looked at you and pointed and vocalized at the same time, are they able to coordinate all those means of communicating? For impairment in communication, are they showing? Are they pointing? Do they have unusual prosody? Or is there jargon language? And there's some language patterns we see with kids with autism where they'll make almost self-stimulatory vocalizations like digga 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 with their tongue and mouth. They'll have they may grunt, they may squeak, they may squeal. So there's some unusual vocalizations that sometimes we see. Using a person's hand as a tool, we see that frequently where a child will take their parent's hand and put it on a jar to open it or a door handle to open it. The flip side is a child who has hyperlexia. In other words, this is a child who can read at an early age. They can understand, recognize letters, even read some beginning words, yet they might not have the functional language to get their needs met. We also talked a little bit about repetitive behaviors and restricted interests. This is where kids who walk up on their tiptoes, who have finger twisting, who flap, who spin, who maybe smell something before they play with it, or lick a toy before they play with it, or they're have a huge interest in one particular toy. So they may, and we all maybe had our favorite blanket, but they maybe have to have a toy or specific thing carried around with them all day long. Have any of you had children with autism in your practice or early interventions where you've seen some of these types of behaviors?
I have often, because I administer the ADOS.
Oh, wow.
And so I was thinking about our little conversation earlier. It's so nice to get a refresher and to hear somebody's voice talk about these rather than me looking through the manual. I administer over here at Dolores Gonzalez.
I'm sorry, where?
At Dolores Gonzalez, the early evaluation team, Child Find.
Oh, you were at Child Find. That's great.
Yeah.
Your reports are so amazing. They're so thorough.
Oh, thank you.
Sometimes we see kids that have already seen you, and then we have the report, and your reports are so thorough.
Yeah, we see your reports too, and they're fantastic.
All 20 pages of them, huh? We need to work on that a little bit. They're not exactly user-friendly. Sometimes I think because each discipline writes a segment so that it would stand alone, like if just a speech therapist read the speech therapy part or Pete's read the Pete's part. But yeah, I think the videos in this module are terrific. I think you'll really like the ones coming up too.
Okay.
So let's just go to the videos.
So you work with Sylvia Sarmiento?
So this is Nathan and Ben. I'm not sure who's first.
Uh-oh. Yeah, it fell off. That's right. Here it is. Uh-oh. Go!
So here's the other twin.
Push. Good boy. Ready, set, go! You can push. Stay up here. Stay up here. Go! Stop. Look. Nathan. Go! Look, here it is. Here's the train. Stay up here, please. Push. Good boy. Ready, set, go! You can push. Yeah, it fell off.
So, wow. Big difference between these twins. Does anybody want to see the video again, or are you guys okay with just once?
Just one's okay for me.
Okay.
I'm good.
So, Ben, the first twin, he's got great eye contact, great engagement. Uh-oh, he says, and imitates push, and you can see that Nathan, on the other hand, even when sort of primed with some of those words that we use to help kids get ready, like ready, set, and then go, or 1, 2, 3, go, he still doesn't stay in the engagement. In fact, he turns his back to her and starts to try to climb out of the chair. So just a big difference between the twins. And this is also to remind me that, picking kids up with autism early really helps families in terms of planning. So, for example, we know that there's a higher risk of having another child with an autism diagnosis if you already have one. Those numbers range between 2 and 18% chance of having a second child. And about 5 to 10% of kids will have an identifiable medical diagnosis or genetic diagnosis. So, in terms of helping families think through their family planning or whether they want genetic information is important. Identical twins have a very high concordance rate. It's interesting. Studies go across the board from about 35% to about 90%, where if one identical twin has autism, the chance that the second twin will have autism also. I have one more video. This is echolalia, and when you first see this little guy, he seems pretty social. He greets, actually he first tries to escape, but then he greets the therapist, and then just listen to how everything he says has exactly the same tone as his therapist.
Hi, Lucas.
Hello, Lucas.
Say no. Say hi, Georgia.
Hi, Lola.
Give me a hug. Come here. Come here. I gotta tell you something. Hi. Give me a big hug. Oh. How are you?
Hi.
Say, I'm fine.
I'm fine.
Good. Good. Are you playing?
I'm fine.
See. Oh, it's cold. Look.
So such a sweet little guy, really, and joyful, but that's unusual language. Have you guys seen that before? You've probably seen it at Child Find.
Actually, I'm trying to remember where. So you're saying he has autism, and we saw this bit right here of the echolalia.
We saw this as an example of echolalia, and I'm with you. I would need to see a whole lot more of this little boy before I was willing to say that he was on the spectrum, but he does have unusual language, I think.
Yeah.
The autism case training presents it as a child with autism, but I think in this 1-minute video, I would be really hard pressed to say that, wouldn't you?
Yeah. I'm not arguing whether he does or doesn't. It just I would need to hear for how long that goes on, that he is repeating, and the intonation's there, and I think he's got some good intonation. It sounds like to me from what I heard, but if it goes on like that all day, all the time, that's really unusual language.
Right. And that's a great point, because a lot of kids echo. Typically, that's a typical part of language acquisition is to repeat. And one of the distinctive factors from my reading is that, for instance, if you say, "Do you want juice?" A child with echolalia may say just like that, "Want juice?" Whereas a child who's repeating to learn might say, "Want juice!" Sort of exclamation point. So they may take it and change it a little bit, even though they're echoing the same words. So I think it can be sort of subtle differences, and you're exactly right. You need to look at it over time and in the context of other social skills and things like that. So I don't know how many of you need to sign off at 1. That's sort of the end of the formal part of our discussion. So, when we review these references and we talk to Elizabeth, and someone brought up that they really commended her for picking up these issues so early, and I agree. She tears up. She's worried that it's autism, but she isn't sure, and how could this be missed? So again, just to drive home the point, any of us who work with children are in a position to make these observations and to take them very seriously. So I'm not sure if any of you have ever been in this position or what you might tell Elizabeth to do. I think we're all lucky now that there's an MCHAT, which is the Modified Checklist for Autism in Toddlers that pediatricians are recommended to do at 18 months and at 24 to 30 months. And that's actually the next module is about administering the MCHAT, and then there's a follow-up interview to the MCHAT whenever children have concerning answers. So any comments about this or criticism? Certainly welcome.
I thought the information was excellent. I don't have to do any of the testing. I'm a nurse, so when we do child find, I do hearing and vision, but which is difficult with that age group, by the way.
It is.
But the information here is really, really interesting and eye-opening. I think about how many times I've seen different things like this that I wouldn't have thought anything of. I just thought weird kid.
I think the information's really good, and it's great to have these handouts and to hear, like I said earlier, or I was trying to say that I really appreciate the ability to hear this explanation from a professional. I get, I'm in my own head and in the manual of the ADOS so much. Well, actually not so much. It's been maybe 7 or 8 months since I've administered an ADOS.
Oh, wow.
So to hear you talk about it is just so refreshing.
Oh, thank you. I'm glad. And there's a toddler ADOS coming out, too.
Yeah. We were just involved in a training with Carla, Maddie Souls and Carla Arnold. And so February 14th, they're going to train us on the toddler module and the module 1 of the new ADOS. And I won't be able to use it because I work with the bilinguals, and so they're still norming some standardizing the norms for the Spanish portion of the ADOS 2.
That's good to know. And I'm not sure you can use the toddler ADOS over 30 months.
Right, yeah.
Right? So some of the
see.
kids at Child Find might be too old.
Yeah, I'd be looking at Module 1 and Module 2 for most of the kids here.
But the ADOS, because not everyone is necessarily familiar with the ADOS, but it stands for the Autism Diagnostic Observation Schedule. And it's just a bunch of presses to look at how children interact to different social settings, like you might blow bubbles and then stop and hold the bubble bottle up high and look to see how the child asks you for more. It's about 45 minutes to an hour long series of presses to look at how children engage and interact and communicate in certain settings. And like I mentioned, one of the things is a birthday party, but in the new toddler ADOS, it's a bath. So I think that's a little more familiar to
What is
children.
it, a bath?
Hopefully they take a bath instead of have a birthday party. So they don't take a bath, obviously. The doll takes a bath.
Yeah. Cool.
But that's, more familiar, I think, to toddlers than a birthday party.
Yeah, that makes sense.
Yeah, it does. Although I have to admit, one of our psychologists brought up that, having a baby get undressed and get in a bathtub can be kind of activating for some children who've had anxiety in that setting. And so it'll just be interesting to see how it all plays out. But we're going to start using it in January also, the toddler ADOS for our younger kids. So we'll see how that goes. Other comments, questions, any resources I can help anyone with, or...
So in the schools, if we had a child now, I like a 5-year-old, a kindergartner, that we were wanting to recommend to have autism screening, we'd be able to call the number there for that?
You're welcome to call me. We see children 0 to 3. So the children who are like 3 to 20 are seen in an older children's clinic. It's called, I think they might have just changed it. It used to be the Neurodevelopment Clinic. I think it might have a new name, but the main number for the Center for Development and Disability is 272-3000. That's just and you can just say you have a 5-year-old and you want to be directed to the autism evaluation for that age group. But you're always welcome to call me or email me, and I'll send that to you in email.
Thank you.
Sure. Thank you guys so much for participating, and we'll keep you posted about, there are 7 modules altogether, and they all have videos that are associated with them. The next one is about the MCHAT, and then there are some about diagnosing, and then some about how to talk to families about diagnosing, and others about behavioral approaches to autism and anticipatory guidance for kids with autism in the pediatric office. So there's a whole range of modules after this one.
Thank you.
Thank you.
Sure.
Thank you.
Thanks for signing on. Okay. Happy Thanksgiving, everybody.
Yeah, you
Thank
too.
you.
You too.